several different types of bone cancer that develop in the bones. When cancer cells grow in the bone, it can harm normal bone tissue. Bone cancer occurs when a tumor or atypical mass of tissue forms in a bone. These are called bone sarcomas. A tumor may be malignant, which means it's growing aggressively and spreading to other parts of the body. A malignant tumor is often referred to as cancerous. Bone cancer can begin in any bone in your body, but it most commonly starts in the pelvic bone or the long bone in your legs or arms, such as your shin bone, femur, or upper arm. Cancer may also begin in another area of the body and spread to the bone. Cancer is usually named for the location where it starts. Concerns that form in the bone itself are called primary bone cancers. Primary bone cancers are the most serious of all bone cancers. They form directly in the bones or surrounding tissue such as cartilage. There are three types of the most common bone cancer, which are osteosarcoma, chondrosarcoma, and Ewing sarcoma. Definition of osteosarcoma is a type of bone cancer that usually develops in the osteoblast cells that forming the bone. It usually happens to the children, teenagers, and young adults. Osteosarcoma generally affects children and adolescents, but it can also occur in adults. It has a tendency to originate at the tip of the long bones in the arms and legs. Osteosarcoma may also start in the hips, shoulder, or other locations. It affects the hard tissue that provides the outer layer of your bone. Osteosarcoma is the most common type of primary bone cancer, causing 2 in 3 bone cancer cases. It happens usually in males rather than females. Osteosarcoma commonly happens in the long bones around the arms and legs. It usually occurs near metaphysis and near the knee, where the fastest growth is taking place. If you are a teenager, the bones and areas most often affected include the femur, thigh bone near your knee, tibia, shin bone near your knee, humerus, upper arm bones near your shoulder, rarely in the soft tissue or organs in your abdomen or chest. Other less common locations for osteosarcoma include the pelvis and skull. Diagram 1 shows the normal long bone of the human. The structure of the bone consists of the proximal epiphysis, distal epiphysis, metaphysis, and diaphysis, while the diagram 2 shows that the bone has been infected by osteosarcoma cancer cells. The characteristic radiological features are sunburst appearance, periosteal lifting, the formation of Goodman's triangle new bone, formation in soft tissue along with permit pattern of destruction of bone and other fractures for specific type of osteosarcoma.
Assalamualaikum and hi to Madam Siti Halus. My name is Nurini Khalida binti Ahmad Nashuha. My matric number is DNS07210068. So today I want to explain my part, which are the etiology of the osteosarcoma cancer. Osteosarcoma is the one of the most common type of the bone cancer. It is most common primary malignant bone tumor. There are 2 types of the main age of the group who are commonly to have osteosarcoma, where there is bimodal distribution that affecting the first around group, which is adolescent around 10 to 14 years old, and again in the 7th decade, which is 17 to 18 years old. Some of the most sites of the osteosarcoma can occur are at the proximal and the distal of the femur, proximal of tibia, and also humerus, where the majority of the long bone growth. Next, for the etiology or causes of the osteosarcoma cancer is influenced by many factors. For the first causes, presence of certain benign non-cancerous bone disease. As example, if someone have Paget's disease, it may be lead into osteosarcoma. Paget's disease is a disease of bone interferes with your body's normal cycling process, in which new bone tissue gradually replaces old bone tissue. Over time, bones can become fragile and mishappen. The Pelvis, skull, spine, and legs are most commonly affected. Because of the osteosarcoma is a bone cancer that develops in the osteoblast cell, it will poorly form bone cells that can invade and destroy healthy bone tissue. For the second point of the etiology of the osteosarcoma is the previous radiation that patients get from the some treatment can causing osteosarcoma cancer. This is because people who were treated with radiation therapy of another cancer appear to have a higher risk of later developing osteosarcoma in the area that was exposed to radiation. Being treated at younger age and being treated with higher doses of radiation both increase this risk. On the other hand, the next point of causes of osteosarcoma is bone infarct. Bone infarct or osteonecrosis refers to ischemic death of the cellular elements of the bone and marrow. Bone infarct is a localized bone necrosis or as known as death of cell which consists of osteocytes, hematopoietic and fatty marrow in bone tissue. This disease is associated with local vascular ischemia. Femoral head is the most common size. Next, another etiology of osteosarcoma is fibrous dysplasia. Fibrous dysplasia is an uncommon bone disorder in which scar-like fibrous tissue develops in place of normal bone. This irregular tissue can weaken the affected bone and cause it to deform or fracture. Fibrous dysplasia happens due to a chemical defect in the specific bone protein. This defect may be due to a gene mutation present at birth, although the condition is not known to be passed down in families. Fibrous dysplasia is not associated with cortical destruction, except in the cases they are associated with a pathologic fracture. In contrast, the majority of central low-grade osteosarcoma shows some degree of cortical destruction with or without soft tissue extension. Osteosarcoma also can happen because someone had chronic osteomyelitis. Chronic osteomyelitis represents a progressive inflammatory process caused by pathogens resulting in bone destruction and sequestration formation. It may present with periods of quiescence of variable duration, where its occurrence type, severity and prognosis is multifactorial. Chronic osteomyelitis can lead to bone cancer because people with chronic osteomyelitis are more likely to have recurring abscesses. Treatment to drain these abscesses may slightly increase the risk of skin cancer. Bone death, also called osteonecrosis. Bone death can occur if swelling from the infection cuts off blood flow to your bone. Lastly, the etiology or causes for osteosarcoma is liposclerosing myxofibrous tumor. Liposclerosing myxofibrous tumor is a rare tumor of the bone which was first described in 1886. It is a benign fibrous lesion which has myxoid areas, osteoclastic activity, bone tuberculosis similar to fibrous dysplasia, fat necrosis, ischemic esophageal, and rarely cartilage component. It is found to occur most commonly in the fourth decade of life and proximal femur, which are related osteosarcoma target location.
Assalamualaikum warahmatullahi wabarakatuh. My name is Zainab binti Azman, GNS 072101. Today I would like to present about pathophysiology of osteosarcoma. Osteosarcoma, one of the common primary tumors of bone. It was arise from osteoblasts, also called pleomorphic with different size, and occurs mainly in the metaphysics of the long bones, where there is a lot of cells divisions. Osteoblast cells build up new bone and have produced too much osteoid tissue, which is unmineralized organic portion of bone matrix that forms prior to the maturation of bone tissue. Osteosarcoma, also called bone forming tissue. Other than that, no mutation like PRB protein that is found in familial retinoblastoma, a childhood malignant tumor of the eye, and the P53 protein also seen in Li-Fraumeni. There are several syndromes associated with osteosarcoma, which is Blum syndromes, Warner syndromes, and Rockman-Thompson syndrome.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nurul Akilah binti Muhammad Rizal and my matric number is GNS 141. In my topic, I will explain about the 3 types of bone cancer clinical magnifications. The most common symptoms of osteosarcoma including is number 1 is bone pain or tenderness. Number 2 is a mass or lump tumor that is formed and might be felt through your skin. Number 3 is swelling and redness at the sides of your tumor. Number 4 is increased pain with lifting, affects your arm. Number 5 is limping, affects your leg. Number 6 is limited movement, affects a joint. Number 7 is unexplained fever. Number 8 is broken bone. Sometimes this happens after a simple movement. Pain at the site of the tumor in the bone is the most common symptom of osteosarcoma. The most common sites for this tumor in younger people are around the knee or in the upper arm, but they can occur in other bones as well. At first, the pain might not be constant and might be worse at night. The pain often increases with activity and might result in a limp if the tumor is in a leg bone. Swelling in the area is another common symptom, although it might not occur until later. Depending on where the tumor is, it might be possible to feel a lump or mass. Limb pain and swelling are very common in normal, active children and teens. They are much more likely to be caused by normal bumps and bruises, so they might not prompt a doctor visit right away. This can delay a diagnosis. If your child has these symptoms and they don't go away within a few weeks or they get worse, see a doctor so that the cause can be found and treated if needed. These symptoms are less common in adults, so they should be assigned to see a doctor even sooner. Although osteosarcoma might weaken the bone it develops in fracture, are not common. Exceptions are rare osteosarcomas, which tend to weaken bones more than other forms of osteosarcoma and are more likely to cause breaks where the tumor is. People with a fracture next to or through an osteosarcoma often describe a limb that was sore for a few months and suddenly became very painful when the fracture occurred.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Nabil bin Zulkari, name N07210113. So today I will talk about investigation of osteosarcoma. So firstly, you can use radioisotope bone scan. Radioisotope bone scan can look for change in the bones. It usually if you have bone pain or blood test results show high level of alkaline phosphatase. This may be sign that the cancer has spread to the bones. If cancer is found in the bones, the scan can also be used to check how the cancer is responding to treatment. After the scan, you need to drink plenty of fluids and you should avoid contact with young children and pregnant women for the rest of the day, as it uses a very small amount of radioactive solution. Second, tissue biopsy. The most effective way of diagnosing bone cancer is to take a sample of affected bone and send it to a laboratory for testing. This is known as a biopsy. A biopsy can determine exactly what type of bone cancer you have and what grade it is. Third, X-ray. Panel scan of the bone which can reveal bone damage or the creation of new bone. Fourth, you can use magnetic resonance imaging, MRI or CT scan. Both of these special computer use can help to scan and make a clear picture to point out any bone abnormality. 5. Lastly, you can use position emission tomography, PET scan. PET procedure will make the patient get injured with a small amount of radioactive glucose solution to highlight any cancerous area on the skin.
Definition: chondrosarcoma cancer. Chondrosarcoma is a type of bone cancer that starts in cartilage cell. Cartilage is the smooth connective tissue that protects the ends of bones and lines most joints. Most bone develop from cartilage and it plays an important role in the growth process. There are many different types of cartilage all over the body. Chondrosarcoma mainly affect the cartilage cells of the thigh bone, the femur, shoulder, or pelvis. Less often it starts in the knee, rib, skull, and part, trachea. Chondrosarcoma is the second most common type of primary bone cancer in adults. A primary bone cancer is one that starts from bone cell. It's not the same as cancer that starts in another organ and then spread to the bone. That called metastatic cancer to the bone or bone metastasis. Cancer starts when cold change its differentiate and grow out of control. The changed abnormal cells often grow to form a lump or mass called a tumor. Cancer cells can also grow into invade nearby areas. They can spread to other parts of the body to this called metastasis. Diagram 1 show a normal bone without infection, and diagram 2 show bone with infection chondrosarcoma cancer.
Hi, now I want to share about the etiology for the second common types of the cancer, which are chondrosarcoma. Chondrosarcoma is the second most common type of primary bone cancer. A primary bone cancer is one that starts from the bone. This is opposed to starting another organ and then spreading to the bone. This type of cancer rarely affects individuals under age 20. The risk continues to rise until age 75. The incidence between males and females is equal. There are a few etiologies of chondrosarcoma cancer. For the important reason is surely may be a genetic or chromosomal component that makes certain individuals more open to this type of malignancy. The second causes of chondrosarcoma cancer is Maffucci syndrome. Maffucci syndrome is an extremely rare disorder characterized by benign overgrowth of cartilage and chondromas, skeletal deformities, and cutaneous lesions composed of abnormal blood vessels. And chondromas arise in bones most frequently in the hands and feet and less often in the legs and long bones of the arm. The first sign of Maffucci syndrome is usually finding an enchondroma in a long bone. Enchondromas distort and weaken the affected bones, thus initial presentation with a pathologic fracture is common. These cartilaginous tumors cause bulging of the bones, bowing of the arms and legs, and often asymmetric growth, different lengths of the arm or legs. The patient may exhibit short stature in adulthood. Enchondromas affect only one side of the body in approximately 40% of the patient. Next, another etiology of chondrosarcoma cancer is Ollier disease. Ollier disease is a rare skeletal disorder characterized by abnormal bone development, or as known as skeletal dysplasia. While this disorder may be represented congenital, it may not become apparent until early childhood when symptoms such as deformities or improper limb growth are more obvious.
Now, I would like to present about pathophysiology of chondrosarcoma. The cause of chondrosarcoma is not clear. Chondrosarcoma arises from chondrocytes and it mainly affects bones of the pelvis. Also can affect long bones such as proximal femur. Chondrosarcoma also are genetically heterogeneous. Some chondrosarcomas arising in multiple osteochondrome as have mutation in EXT genes. Some sporadic and chondromatosis related to more show IDH1 and IDH2 mutation. This mutation also called somatic mutations that only found in cells that become cancer. Other than that, silencing of the CDKN2A tumor suppressor gene by DNA methylation is also seen fairly commonly in sporadic chondrosarcomas. CDKN2A stands for cyclin-dependent kinase inhibitor 2A, which is provide instructions for making several tumor suppressor proteins.
The second one is chondrosarcoma. Chondrosarcoma tends to grow slowly, so it might not cause signs and symptoms at first. Signs and symptoms of chondrosarcoma may include: the first one is increasing pain. The second one is a growing lump or area of swelling. The third one is weakness or bowel and bladder control problems if the cancer presses on the spinal cord. Like most bone cancers, pain in the bone and swelling is the most common symptoms of chondrosarcoma. Other symptoms can be fatigue, fever, unintentional weight loss. Pain is the most common symptoms of bone cancer, but symptoms may vary depending on where the cancer is. There may be some swelling in the area, and it may be painful to touch. Primary bone cancer is sometimes found when a bone that has been weakened by cancer breaks. This could be after a minor fall or accident. These symptoms can be caused by other conditions that are more common than bone cancer. If you have any swelling or unexplained bone pain, get it checked by the doctor. Tell the doctor if the pain happens at night and when you are resting.
For chondrosarcoma, you can use X-ray and magnetic resonance imaging, MRI and CT scan.
Definition of Ewing sarcoma. Ewing sarcoma is a malignant cancer that usually begins growing in the bone. It occurs primarily in children and young adults, often occurring during the teenage years. Although Ewing sarcoma can develop in any bone, it usually affects the long bones such as the thigh bone, the femur, shin bone, tibia, and upper arm bone, humerus. The bone of the pelvis are also often affected. Occasionally, the tumors begin in the muscle and soft tissue. This is called extraosseous Ewing sarcoma. Ewing sarcoma can spread to metastasize to other parts of the body, such as the lungs, bone marrow, and other soft tissue. Diagram 1 shows a normal bone without infection, and diagram 2 shows bone with infection Ewing sarcoma.
Next, for the etiology of Ewing sarcoma. Ewing sarcoma are a type of cancer that occurs in bone or in the soft tissue around the bones. Ewing sarcoma most often begins in the leg bones and in the pelvis, but it can occur in any bones. Less often, it starts in the soft tissue of the chest, abdomen, lips, or other location. There are a few causes of Ewing sarcoma cancer towards someone, but the common etiology is the majority sarcomas came from the result of a chromosome rearrangement between chromosome 11 and 22. This rearrangement changed the position and function of genes, causing a fusion of genes referred to as a fusion transcript. The rearrangement between chromosome 11 and 22 is known as a reciprocal translocation and is the most common recurring reciprocal translocation seen in humans. A reciprocal translocation means that there is a two-way exchange of information between these two chromosomes. DNA is the chemical in each of our cells that make up our genes. Genes tell our cell how to function. They are packaged in chromosomes, which are a long strand of DNA in each cell. We normally have 23 pairs of chromosomes in each cell. One set of chromosomes comes from each parent. We usually look like our parents because they are the source of our DNA, but DNA affects more than how we look. The another causes of Ewing sarcoma cancer is the previous radiation that patients get from some treatment can causing Ewing sarcoma cancer. This is because people who were treated with radiation therapy for another cancer appear to have a higher risk of later developing Ewing sarcoma cancer in the area that was exposed to radiation. Being treated at a younger age and being treated with higher doses of radiation both increase this risk.
Now, I would like to present about pathophysiology of Ewing sarcoma. Ewing sarcoma occurs in the diaphysis of bone about 50% of the time. It occurs most commonly in the femur, the tibia, the pelvis, and also in the spine. It is associated with chromosomal mutations, specifically a translocation between EWSR1 gene on chromosome 22 and FLI1 gene on chromosome 11. The EWSR1 FLI1 combination produces an abdominal protein expression called Ewing sarcoma protein that causes defects in the different process of human mesenchymal stem cells and neuroectodermal cells. Sometimes the tumor is liquefied so as to resemble a pus. Other than that, Ewing sarcoma often of semi-liquid consistency, soft and looks grayish-white to pink in color. The tumor also will have small, round blue cells. The nuclei are prominent and there is minimal cytoplasm. The cells may arrange in the pseudorosette fashion. Ewing sarcoma mimics infection. The patient will complain of pain, fever, tenderness, and a mass of swelling. The sedimentation rate and white blood cell count could behind.
Ewing sarcoma symptoms come and go before becoming consistent. About 85 children and teenagers cancers who Ewing sarcoma have been. Other symptoms are, the first one is stiffness, swelling or tenderness in the bone or in the tissue surrounding the bone. Number 2 is lumps near the skin surface that may feel warm and soft to the touch. Number 3 is fevers that don't go away. Number 4 is broken bones that happen without an injury. Number 5 is weakness or numbness in the affected area. Number 6 is lack of energy. Pain often comes and goes, initially, eventually progressing to be more consistent. Weakness and numbness in the affected area can also occur. In some cases, affected individuals may also experience fever, lack of energy, weight loss, low levels of circulating and red blood cells, an increased level of circulating white blood cells. A palpable mass is often present. These tumors are often aggressive and may spread to additional areas of the body, especially to other bones and the lungs. In rare cases, the bone marrow may become involved. Symptoms associated with these tumors are secondary to their location. For example, a tumor of the leg may result in a limb. A tumor in the lungs may result in breathing problems and accumulations of fluid in the tissues layers that line the lungs and chest cavity. Or a tumor in the spinal column may cause weakness or paralysis of affected muscles.
For Ewing sarcoma, you can use tissue biopsy or CT scan.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Faiza binti Abdul Rahman, DNS 039. So today, I want to talk about the treatment of bone cancer in medical. So the first one is osteosarcoma cancer. All diseases require medicine to treat the disease phase. Medicine for osteosarcoma cancer is methotrexate. Methotrexate is used to treat serf psoriasis, which is a skin disease in which red, scaly patch form on some areas of the body that cannot be controlled by other treatments. Methotrexate treats cancer by slowing the growth of cancer cells. Take this medicine only as directed by your doctor. Do not use more of it. Do not use it more often. And do not use it for a longer time. Do not take this medicine every day to treat condition other than cancer. The dose of this medicine will be different for different patients. Follow your doctor order or the direction on the label. The following information include only the average dose of this medicine. If your dose is different, do not change it unless your doctor tell you. So, the second cancer is chondrosarcoma cancer. The medicine for chondrosarcoma is doxorubicin. Doxorubicin is also used alone and in combination with other medication to treat certain type of thyroid cancer and certain type of soft tissue or bone sarcoma, which is cancer that forms in muscle and bones. Doxorubicin is in a class of medication called anthracycline. It works by slowing or stopping the growth of cancer cell in your body. Doxorubicin can be administered by intravenously. This medicine is given through a needle placed in one of your vein. The second medicine of Ewing sarcoma cancer is cyclophosphamide. Cyclophosphamide is used for retinoblastoma, which is a type of eye cancer mainly in children. Cyclophosphamide interferes with the growth of cancer cells, which are then destroyed by the body. Since the growth of normal body cell may also be affected by cyclophosphamide. Other effects will also occur. Some of these may be serious and must be reported to your doctor. Other effects, like hair loss, may not be serious but must concern. Before you begin treatment with cyclophosphamide, you and your doctor should talk about the benefit of this medicine as well as the risks of using it.
Hi, my name is Nur Atika Akila binti Nurizam. Today I'm going to talk about treatment surgery for bone cancer. Surgery is the fastest way of any kind of treatment. Same goes for bone cancer. Other than medical treatment, bone cancer can be treated or prevented by the surgery process effectively. Few surgeries are common to treat bone cancer. Every surgery has its benefits and risks. Priority to perform the surgery depends on their cancer condition. Limb sparing, rotation-plasty, and amputation is the most common surgery that are preferred for patients with bone cancer. Limb sparing surgery or limb salvage surgery is the main operation for primary bone cancer. 85% of osteosarcoma are treated this way. This procedure can remove only cancer without removing the limb. The area that removes may be replaced with a metal implant or replacement bone. Anesthesia was given before the surgery. After all the cancer was taken out, a margin of healthy tissues all around the cancer was also taken out to make sure all cancer has been removed. Then, the operation ends with the reconstruction part. The post-operative effect, this procedure is the part of the body that include will not be as strong as before. Next, rotation-plasty was a rare solution for bone cancer and was the highest success rate. The surgical procedure is used to treat bone tumors that occurs around the knee. The bottom of the femur, the knee, and the upper tibia that contain tumors are surgically removed. The lower leg rotating 180 degrees to serve as the new knee joint, and the backward-facing foot will fit into the custom-fit artificial lower limb. The surgery can take almost 10 hours to complete. Rotation-plasty also performed on patients of old age, but is mostly done in children and teens because their bones are still growing. Rotation-plasty is performed to prevent disease from spreading to other parts and not to cure bone cancer. Rotation-plasty that is performed on children is effective as their bones will still continue to grow with them. The prosthetic leg used with rotation-plasty will be fit and changed as they grow. This helps them to more physically active. Somehow, this procedure also has its own risks such as wound healing problem or infection of the wound. Bleeding, blood clots, and poor bone fusion also are the risks of having rotation-plasty as this procedure is major procedure. The next surgery is amputation. Amputation is the process of removing part of the body completely. This procedure used to treat primary bone cancer in an arm or leg and will only be performed if there is no option to clear cancer. If cancer in the bone has grown into the major nerve and blood vessels, or limb-sparing cancer is not possible to completely remove, amputation is a must to protect another part of the limb. Other than surgery, chemotherapy and radiotherapy are also effective treatments for bone cancer. Chemotherapy is given in IV or pill form and used to kill cancer cells. Chemotherapy is usually recommended before surgery to see if the cancer cells shrink to proceed the limb-sparing surgery. If chemotherapy doesn't work, more aggressive treatment is recommended. Next is radiotherapy. Radiotherapy uses high-energy beams like X-ray and proton to kill cancer cells. Radiation may be needed if surgery isn't possible. The beam's energy was delivered by a machine that moves around you when you lie on the table. The beams are directed to the area that affected to reduce the risk of damage.
Hi, my name is Nur Ines Sofia binti Nurihan and my matrix number is DNS 07210070. Okay, I will explain about bone cancer treatment in a nursing care plan. For the nursing diagnosis is anxiety related to the treat of that which is related to osteosarcoma. The first intervention is assess the patient's level of anxiety and how it indicates the need for anxiety relief. This because to provide information about the patient level of anxiety to relieve it. For example, patient feel disability or death. The second intervention is to monitor the patient with vital signs such as taking blood pressure and checking pulse rate, because it can determine whether the patient has high blood pressure. And the third intervention is monitor the patient condition from time to time, because to ensure that the patient condition is stable from anxiety. In addition, for the fourth intervention is assess the possible need for special counseling service for patient in order to support the patient ability to cope with the disease and promote adaptation to lifestyle change. The fifth intervention is to advise the patient family to visit or accompany the patient regularly so that it can improve care and promote emotional comfort to the patient. The sixth intervention is communicate with the patient based on the developmental age level and answer questions calmly and honestly using picture, model and drawing for explanation so that it allow better understanding and promote trust. And for the last intervention is introduce the patient to other people who have the same disease and amputation to be able to provide information and support from peers with the same condition, and it will have the same empathy.
Hi and Assalamualaikum. My name is Amira Afika binti Muhammad Azhar. My matrix number is DNS 07210006. So, I would like to present treatment of bone cancer in rehabilitation. Okay, so the rehabilitation is process of returning the patient to original condition. It can be defined as restoring the condition of good health or ability to work hour or the same way as physiotherapy and occupational therapy. Is a type of rehabilitation that can be included in the rehab plan to help in regaining the body strength. In physiotherapy, this therapy related to physical parts of suffer patient. Physiotherapy is mostly focused on movement of body organs and body strength. Physiotherapy interventions will consist of early post-surgical mobility training, strength and endurance restoration, pain control and education, also training of family members in helping patients with limited mobility. Physiotherapy treatment can help correct body balance and coordination disorders. In this way, it can increase the patient independence, educate and train family members to help and enable the patient to move freely. Physical therapy includes stretching, straightening, and aerobic exercise for the inpatients, outpatient, and cancer survivors. It often helps patient regains strength, physical functioning, quality of life, and independence in activities of daily living that they may have lost due to cancer or its treatment. So, the second point of rehabilitation is occupational therapy. Occupational therapy is a recovery to return to daily activities to leisure interests. This therapy is very important to patients to improve their recovery and quality of life. Occupational therapy can help patients who are experiencing changes in their mental or physical terms to regain their skill in the performing basic activities. There are many benefits we can get from this therapy. For example, we can help patients with basic tasks like getting dressed on their own or high-level ones like caring for their children. Integral parts of the interdisciplinary team
practitioners of these disciplines provide service that enable patients to archive their highest functional status to permit them to retain their role in society and hence enjoy dignity and improve quality of life.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Azimin bin Muhammad Saupi. My metric number is DNS 07210021. Today I will be presenting about complication with treatment and without treatment. Treatment for bone cancer is many, but did you know patient will get complication if they seek treatment for this disease? But if patient do not seek treatment, the patient condition will worsen. Here I will describe the complication that will befall to the patient if the patient got treatment and if the patient doesn't get a treatment. Firstly is chemotherapy. Chemotherapy is treatment who attack the cell of the human body that divided rapidly. This type of treatment will kill cancer cell along with skin cell and digestive cell. Other than that, people with cancer who are treated with chemotherapy are more likely to get infection because cancer and chemotherapy destroy the system by reducing the number of leukocytes. This also causes long-term fatigue. It happens because chemotherapy can decrease the number of red blood cells or RBC. Second complication with treatment is radiotherapy. This therapy uses high energy rays to kill cancer. Most bone cancer cells not easily killed, so high dose of X-rays energy are needed. Consequently, it can cause more serious side effects such as inflammation of the lung tissue. If this thing happens, it can cause breathing problems, pain, chest tightness, extra mucus and fatigue. If it goes on too long, your airway could change in ways that make it hard for you to get enough oxygen. If someone gets radiation to the pelvis, it can damage the bladder and intestine, which can lead to problem with urination or bowel movement. This therapy also might damage joint. As example, a place where two bones come together, which could result pain, scarring, and limited range of movement. Additionally, this treatment will lead the patient to the new cancer, which because of the high dose of radiation could trigger another cancer called second primary cancer. Surgery. Surgery is an important part of treatment for most types of bone cancer. Surgery to remove bone cancer can often be long and complex operation. Serious short-term side effects are not common, but they can include reaction to anesthesia, excess bleeding, blood clot, and infection. Pain is common after the operation, and it might require strong pain medicine, such as opioids, for a while after surgery as the site heals. Complications of limb-sparing surgery can include loose or broken bone graft or prosthesis. Infections are also a concern in people who have had amputation, especially of part of a leg, because the pressure placed on the skin at the site of the amputation can cause the skin to break down over time. It's also possible that the surgery could damage nerve in the limb, which might affect the function of the limb or cause pain, known as neuropathic pain. Lastly, without treatment, if patient doesn't treat the bone cancer, primary bone cancer will appear and can spread to other part of the body. Primary bone cancer is also known as bone sarcoma, which means that they start in the bones. It usually found in children. Secondary metastatic bone cancer means that the cancer start in another part of the body, such as the breast or lung, and had spread to the bones. Other than that, cancer in the bone can cause too much calcium, or as known as hypercalcemia, to be released into the bloodstream. This can affect the proper functioning of the heart, kidney, and muscles. It can also cause neurological symptoms such as confusion, memory loss, and depression. High calcium levels can lead to the coma and death. That's all from me. Thank you.